All right, let's jump right into a topic that honestly affects every single one of us: rapid diagnostic tests. We've all seen them, we've all used them, but what's really going on behind the scenes? Today, we're going to dig into the incredible promise and the tough realities of trying to stop the next outbreak before it even gets started.
Okay, let's kick things off with this really powerful statement from Dr. Girma Kebede. He calls these tests the holy grail of outbreak response. I mean, holy grail, that says it all, right? It perfectly captures the massive hope that we're all placing on this tech. But the real question is this grail actually within our grasp? That's what we're here to find out.
So what does this holy grail even look like in the real world? Well, picture this: a test that's super fast, incredibly accurate, cheap, and available to absolutely everyone everywhere. We're talking from a high-tech city hospital all the way to a tiny, remote clinic in the middle of nowhere. It's the dream tool for public health.
And that's our mission for this explainer, to separate the hype from the cold, hard reality. And look, we're not dealing with guesswork here. Everything we're about to cover is backed up by the heavy hitters. We're talking WHO guidelines, CDC data, and peer-reviewed science. So let's get into it. First things first, let's take a good hard look at what's actually in our toolbox today, right now. What tech is confirmed, on the market, and being used out in the field as we speak. So as of 2023, there are really three main options on the table. First up, you've got your lateral flow tests. You know these. They're the COVID-19 tests most of us have used. The WHO endorses them because they are dirt cheap, like $1 to $5, and it's a big but, they aren't always the most sensitive. Then you have the heavy hitters, CRISPR-based tests. These things promise lab-quality accuracy in about an hour, which is amazing, but there's a huge catch. And finally, you might have seen some headlines about gold nanoparticle tests. Well, here's the reality check. A 2022 paper in Nature confirmed they are still very much in the research phase, not ready for prime time yet.
Remember that catch I mentioned for the CRISPR tests? Well, here it is: $20,000. Yep, a 2023 NIH review found that's the price tag for a single machine needed to run those super accurate tests. That cost alone is a massive, massive wall, making it pretty much impossible to get this tech everywhere it needs to be.
Which leads us right to the absolute core question of this whole explainer. The technology exists, right? We have tests that work, some with incredible accuracy. So why isn't this stuff in every clinic, in every community, on every corner? Well, the answer goes way, way beyond the laboratory.
So let's go there. Let's look at the reality on the ground. Because, having a brilliant piece of technology is one thing, but making it actually work in the real world with all of its messy logistics and human factors, that is a completely different battle.
And wow, this one chart just says it all. A 2023 study in BMJ Global Health delivered this gut punch of a statistic. In rural clinics, a staggering 60% of rapid tests are misused. 60%. That could be anything from collecting a sample the wrong way to misreading the results, or even just storing the tests improperly. It is just a brutal reminder that the most advanced tech in the world is totally useless without proper training.
So what's the way forward? How do we fix this? Well, the Africa CDC has laid out three things that are absolutely critical. First, equipment. We need devices that meet the WHO's assured criteria, which basically means they have to work in places without stable electricity or refrigeration. Second, and this is huge, training. We have to attack that 60% misuse rate and make sure the results we're getting are actually reliable. And third, a One Health approach. That means integrating systems to test both humans and animals, a strategy pioneered by the World Organization for Animal Health.
And this reality check is actually fueling the next wave of innovation. Instead of just chasing ever higher accuracy numbers, researchers and organizations are now focused on a much smarter goal: designing tools that are specifically built to solve these real-world problems.
And here's a little glimpse into that much smarter future. The WHO's R&D blueprint has some really clear, exciting targets for 2025. They're pushing for $10 multiplex tests that can spot 5 or more diseases at once. That's a direct assault on the cost barrier. They also want climate-resilient reagents that won't go bad in hot tropical climates, solving a huge equipment problem. And get this: AI-assisted readers to slash human error and directly address that training gap. Now that is targeted, intelligent innovation.
Okay, we've covered the tech, the tough realities on the ground, and the innovations on the horizon. Now, let's boil all of this down to the single most important takeaway.
It all comes down to this simple but powerful idea, drawn from Dr. Kebede's work.
Real progress requires science, not slogans. It's not about flashy headlines or promising miracle gadgets. It's about the hard, unglamorous, evidence-based work of developing the right tools, training people correctly, and building systems that can actually last. That's how we're going to make a real difference.
So, I'll leave you with this final question to chew on. When we think about stopping the next pandemic, what's the single biggest hurdle we need to clear? Is it a lack of breakthrough technology? Or is it a failure to invest in the people, the training, and the systems that are needed to make that technology truly work? Something to think about. Thanks for joining us for this explainer.